On this video, we're going to discuss another concept under your mental and psychiatric health nursing. I'm gonna break it down to you to the T: impulsive control and conduct disorder. If you want to know more about that, stay tuned.
Choose your fighter.
Welcome back to my channel. If you're new here, my name is Neil Gavin. I'm a registered nurse and I do have a degree in medical surgical nursing. I create my nursing educational videos to help nursing students and nursing professionals like you with their studies. If that is something that you are interested in, consider subscribing. If you're already a subscriber though, thank you so much for your love and support. I see you. I upload my nursing educational videos once a week. Don't miss that out. Subscribe now, hit the notification bell so that you will be the very first to watch my newest uploads. Also, don't forget to give this video a big thumbs up and share with your friends because that will really help me know that you like to see more contents like this. Without further ado, nurses, let's jump into the video. Welcome back to all of you guys, wherever you are right now, whatever time zone you're watching me right now. I just wish you good morning, good afternoon, and good night, just in case I don't get to see you. And yes, welcome to another week of discussion, nurses. On this video, another mental health and nursing video. Mental and psychiatric nursing topic ang alay ko sa inyo for today. Alam ko na it's been a while since the last time I actually uploaded another video lecture regarding sa psychiatric nursing. Kaya naman, dadagdagan natin yung entry natin sa playlist na yon. On this video, we are going to discuss about your disruptive, impulsive control, and conduct behavior or disorder. Now I'm going to give you everything that you need to know from the classification, causes, clinical manifestations, nursing intervention, medical management, and pharmacological treatment. All of that and more in one video. So, medyo mahaba nga po itong discussion na to. I'm not gonna keep you on waiting. I'm not gonna keep you on hold. But before that, I would just like to grab this opportunity to say thank you to you who's watching right now for making my dreams happen. Maraming salamat nga po sa suporta nyo. And kung hindi ka pa nagsasubscribe, pang palaki charm ngayong darating ngayong 2022, mag-subscribe ka na at hit mo na yung notification bell kasi every 7 days nga po ako nag-upload. Follow mo na rin yung Facebook page ko. It's Neil Galve. And yeah, that's it. Without further ado, let me switch back to my PC and I'll see you guys in a bit.
So hi everybody, welcome back sa ating formal discussion ng yung disruptive, impulsive control, and conduct disorders. Let this be your nursing study guide sa pag-aaral mo ng yung mental health and psychiatric nursing. Ngayon, kung hindi mo pa napapanood yung very first discussion na ginawa ko under sa playlist na to sa mental health and psychiatric nursing, ililink ko yung pinaka-unang video na ginawa natin yung regarding sa personality disorders. I-click mo lang o check out mo yung description box or kapag nagpapot yung icon button, i-click mo lang yon kasi naandun sila lahat kasama na yung ibang mga playlist natin sa nursing education. Now, ano-ano ba yung mga dapat mong expect sa discussion na ito? Well, we're going to have a clear definition, clinical definition of your disruptive behavior. We're going to discuss the classification, the causes, clinical manifestations, medical management, pharmacological management, and of course, this will not be a nursing video or nursing discussion. If we're not going to talk about your nursing management, under done, we're going to have the nursing assessment and your nursing intervention. So without further ado, let's start with this discussion. So description, i-define lang natin ito ng very quick. Now, according to DSM-5, oppositional defiant disorder and conduct disorder are presently classified with antisocial personality disorder and intermittent explosive disorder, whereby considering emerging data confirming their clinical and biological commonality along a developmental spectrum. Antisocial personality disorder nga po concerns violations of the rights of others. Intermittent explosive disorder is defined by impulsive, aggressive, and assaultive behaviors that are not of that are out of proportion to stressors. This is how we clinically define your disruptive behavior. Now, in terms of classification naman, sa mga susunod na slide, itatalakay natin yung mga classifications niya. How are we going to identify further or class ng iyong disruptive behavior? Well, on the first one, we have your oppositional defiant disorder o yung narinig mo na yung ODD. Now, a childhood mental health disorder that includes frequent and persistent pattern of anger, irritability, arguing defiance, or vindictiveness toward a person and other authority figures. Meron pa tayo isang classification. We call it intermittent explosive disorder or yung IED. Now, this disorder involves repeated unforeseen episodes of impulsive, destructive, violent behavior or angry verbal outbursts in which the person react grossly out of the proportion to the situation. We also have your conduct disorder, yung CD. Palitan ko lang yung cursor ko ng very, very, very light. So, ano naman tong CD? Now, this disorder o yung conduct disorder. Now, this disorder is characterized by persistent antisocial behavior in children and adolescents that significantly impairs their ability to function in social, academic, or occupational areas. People with conduct disorder have little empathy for others. They have low self-esteem, poor frustration tolerance, and temper outbursts. So yung outburst, yung bigla-bigla na lang silang dito nagmamaoy, yung mga ganon. Conduct disorder frequently is associated with early onset of sexual behavior, drinking, smoking, use of illegal substances, and other reckless or risky behaviors. Next, you have your antisocial personality disorder, ASPD or APD. Huwag malilito ha, nasa classification pa rin tayo. Now, when you talk about your ASPD or APD, this is a mental condition in which a person has a long-term pattern of manipulating, abusing, or violating the rights of others without any guilt. So, naalala niyo yon, yung ibig sabihin na tinalakay ko rin dun sa personality disorder natin, yung antisocial, na andoon sila. So, isa nga sa mga characteristics ng mga taong diagnosed with antisocial personality disorder is that they have a problem with law. Yes, they love violating law. Now, we also have your pyromania. Pyro, anong unang pumapasok sa isip nyo? Fire. Now, this disorder is characterized by an impulse to set fires. Now, the definition focused on the recurrent failure to resist impulses to set fire in persons who were not psychotic, cognitively impaired, or antisocial. Next, we have the last classification of your disruptive behavior is your kleptomania. Now, a rare but serious mental health disorder that involves recurrent inability to resist urges to steal, steal items that the person generally doesn't really need and that usually have a little value. So once again, these are the classifications of your disruptive behavior. Disruptive, mapaminsalang what's this? Mapaminsala talaga. But yeah, this is your classification. Na proceed na tayo. Ano-ano ba yung mga causes ng mental disorder na ito? Now, researchers generally accept that genetic vulnerability, environmental adversity, and factors such as poor coping interact the cause of this disorder. Now, umpisahan na natin to. When it comes to genetics, there is a genetic risk for conduct disorder, although no specific gene marker has been identified. The disorder is more common in children who have a sibling with conduct disorder or a parent with antisocial personality disorder, substance abuse, mood disorder, schizophrenia, or ADHD o yung attention deficit hyperactive disorder. Next, you have your biologic. So when you talk about cause and biologic factors, a lack of reactivity of the autonomic nervous system has been found in children with conduct disorder. This non-responsiveness is similar to adults with antisocial personality disorder. The last cause could probably be because of environmental cause. Now, poor family functioning, marital discord, poor parenting, and a family history of substance abuse and psychiatric problems are all associated with the development of conduct disorder. Once again, these are the causes, risk factors of your conduct behavior or disorder. Now, let's gonna talk about your clinical manifestations. Now, in the following slides, we are going to discuss in details the symptoms of oppositional defiant disorder, intermittent explosive disorder, conduct disorder, pyromania, and kleptomania. Yung mga classifications niya, naalala mo kanina, iisa-isahin natin yung manifestations nila. Handa na ba kayo? Handa na, hinga-hinga. Eto na sila. Let's start with symptoms of oppositional defiant disorder. Now, once again, when we talk about your defiant disorder, i-recap lang natin, this is a pattern of angry, irritability, irritable mood, argumentative defiant behavior, or vindictiveness lasting at least 6 months, as evidenced by the least or by at least 4 symptoms from any of the following categories and exhibited during interaction with at least one individual who is not a sibling. Ano-ano ba yung mga clinical manifestations niya? First up, you have your angry and irritable mood. Ano-ano yung mga mapapansin mo dito? Those persons could probably often lose his temper, often touchy or easily annoyed, and these people are often angry and resentful. Next one, you have your argumentative and defiant behavior. Na ano-ano yung mga dapat mong i-expect sa mga taong o yung manifestation sa kanila, often argues with authority figures or for children and adolescents with adults, often actively defies or refuses to comply with requests from authority figures or with rules, often deliberately annoys others, often blames others for his or her mistakes or misbehavior. Last one, you have your vindictiveness. Wag malilito ha, nasa symptoms pa rin tayo ng oppositional defiant disorder. Vindictiveness, i-define lang natin to. When you say a person is being vindictive, these people are showing spiteful or vindictive at least twice within the past 6 months. So once again, these are the clinical manifestations of your oppositional defiant disorder. Next up, you have your symptoms of intermittent explosive disorder occurring twice weekly, dalawang beses sa isang linggo on average for a period of 3 months. What are those? We have your verbal aggression, temper tantrums, verbal tantrums or tirades, and you have your verbal arguments or fights, physical aggression toward property, animal, or other individuals, and then 3 behavioral outbursts involving damage or destructive of property and or physical assault. So these are the symptoms of your intermittent explosive disorder. Next one, you have your symptoms of conduct disorder. Now, define lang natin siya ulit. When you talk about your conduct disorder, this means a repetitive or persistent pattern of behavior in which the basic rights of others or major age-appropriate social norms or rules are violated, as manifested by the presence of at least 3 of the following 15 criteria in the past 12 months. So, hindi lang siya porket nakita mong nagganito yung pasyente mo, ganito na agad yung kanyang diagnosis. It has to have like a duration and pattern of frequency ng manifestation ng symptoms. It should pass at least 15 of these criteria within 12 months from any of the categories below with at least 1 criteria present in the past 6 months. So when you talk about these are basically aggression to people and animals. You have your often bullies, threatens or intimidates others, often initiates physical fights, has used a weapon that can cause serious physical harm to others. Ano yung mga example nun? Yung paggamit ng bat, brick, broken bottle, or knife, or even gun. Next, you have your has been physically cruel to people. Physically cruel. Now, has been physically cruel to animals, not just people, but also to animals. Has stolen while confronting a victim. Example nun, yung mugging, purse snatching, extortion, and armed robbery. Last one, you have your forced someone into sexual activity. So once again, these are the symptoms of your conduct disorder when talk about aggression to people and animals. Next is symptoms of conduct disorder that includes destruction of property. Next, you have has deliberately engaged in fire setting with the intention of causing serious damage, has deliberately destroyed others' property other than by fire setting. Last one, you have your deceitfulness or theft. Has broken into someone else's house, building, or car. Often lies to obtain goods or favors or to avoid obligations. And has stolen items of non-trivial value without confronting a victim. Wag malilito ha, ito pa rin yung binibigyan ko lang kayo ng examples ng how are you going to define or to demonstrate deceitfulness or theft. So these are some of the few examples para sa inyo. You have your symptoms of conduct disorder that include serious violations of rules. Ano yung una? Often parental prohibitions beginning before age 13 years. Has run away from home, stays out at night despite overnight at least twice while living in the parental or parental surrogate home or once without returning for a lengthy period. You have your often truant from school. Ano yun? Yung mga nagka-cutting classes beginning before age 13 years of age. So these are the symptoms of your conduct disorder with the serious violations of rules. You have your symptoms of antisocial personality disorder. These are the following symptoms. You have your pervasive pattern of poor social conformity. Pervasive, ibig sabihin, malala, exaggerated, maximum level ng poor social conformity. You have your deceitfulness, impulsivity, criminality, lack of remorse. Wala silang pagsisisi sa katawan, yung resent. Wala sila nun. We have your disregard for right and wrong, persistent lying, being tough, cynical and rude to others, using charm or wit to manipulate others for personal gain or personal pleasure. Arrogance, a sense of superiority, and being extremely opinionated. Recurring problems with the law, including criminal behavior. So mapapansin nyo, antisocial, yung pinaka hallmark sign niya is lagi sila merong problems sa pag-follow ng law, rules and regulations. They don't actually like that. And then repeatedly violating the rights of others through intimidation and dishonesty. Hostility, significant, may pagwawalang nagaganap. Hostility, significantly irritable, agitation, aggression, or violence. You also have your unnecessary risk-taking or dangerous behavior with no regard for the safety of self or others, poor or abusive relationships, failure to consider the negative consequences of behavior or learn from them, and lastly, being consistently irresponsible, repeatedly failing to fulfill work or financial obligations. Once again, these are your symptoms of antisocial personality disorder. Now we're going to talk about your pyromania. So fire. Now, presence of multiple episodes of deliberate or purposeful fire setting and failure to resist an impulse to set fires on more than one occasion. Sila yung mga arsonist, yung mga nag-arson. Arson, tama ba? Yon. Persons with pyromania are likely watching the fire in their communities and enjoy setting off false fire alarms. Fascination with, interest in, curiosity about, or attraction to fire and its situation context. Example nito yung paraphernalia uses consequences. Next, pleasure, gratification, or relief when setting fires or when witnessing or participating in their aftermath. You have your fire setting is not done for monetary gain as an expression or of socio-political ideology, to conceal criminal activity, to express anger or vengeance, to improve one's living circumstances in response to a delusion or hallucination, or as a result of impaired judgment. Anong example nito? Yung in major neurocognitive disorder, intellectual disability, intellectual developmental disorder, substance intoxication. Lastly, the symptoms of your pyromania, fire setting, is not better explained by conduct disorder, a manic episode, or antisocial personality disorder. Next up, you have your symptoms of antisocial kleptomania. Klepto Huwag malilito ha, iniisa-isa ko lang sa inyo yung mga symptoms ng mga classification ng conduct disorder. So dito na tayo sa last classification, yung kleptomania. So ano yon? Failure to resist powerful urges to steal items that you don't need, feeling increased tension, anxiety, or arousal leading up to the theft or yung act of theft, yung pagnanakaw na, feeling pleasure, relief, or gratification while stealing, feeling terrible guilt, remorse, self-loathing, shame, or fear of arrest after the theft, return of the urges, and a repetition of the kleptomania cycle. Stealing is not committed to express anger or vengeance and is not in response to delusion or hallucination. Stealing is not better explained by conduct disorder, a manic episode, or antisocial personality disorder. Once again, these are the symptoms of your antisocial kleptomania disorder, which is another classification of your conduct disorder. So how are you going to manage medically this type of mental disorder? Now, because of the multifaceted nature of conduct problems, particularly related to comorbidities, treatment usually includes medication, teaching parenting skills, family therapy, and consultation with the school. So isa-isahin natin to. Sa preschool pa lang, preschool programs such as Head Start result in the lower rates of delinquent behavior and conduct disorder through use of parental education about normal growth and development stimulation for the child and parental support during crisis. Sa school age, for school-aged children with conduct disorder, the child, family, and school environment are the focus of the treatment. Techniques include parenting education and social skills training to improve peer relationships and attempts to improve academic performance and increase the child's ability to comply with the demands from the authority figures. When it comes to your adolescent, how are you going to manage patients who are diagnosed with conduct disorder that are in this age group, yung adolescent phase? Now, adolescents rely less on their parents and more on peers. So treatment for this age group includes individual therapy. So once again, these are your medical management. In terms of your pharmacological management, in the short term, stimulant medicine has proven effective in controlling the specific symptoms of inattention, impulsivity, and hyperactivity. Isa-isahin natin to. So parang tatlo lang naman yung mga recommended drug of choice when it comes to treatment of your conduct disorders. Yung mga ang tinitreat kasi natin dito yung manic episodes nila, yung outburst episode ng mga pasyenteng merong conduct disorder. So what are the drug of choice? So stimulants, the first choice for treatments is stimulants due to their relatively safe side effect profile. However, when misuse or diversion is a risk, the choice of medications that are less abusable, such as Daytrana or methylphenidate in patch form po or Vyvanse medication is oral, however bound to lysine requiring stomach acid digestion in order to be activated. Your next drug of choice, anticonvulsants. Anticonvulsants are considered to be the second group of medication to be used in non-specific aggression. Last one, you have your lithium. Now, lithium methylphenidate reduce the aggressiveness in one set of studies. However, in subsequent follow-up research, the effectiveness of lithium could not be replicated. So once again, these are the drug of choice for your conduct disorder. So may therapy tayo, and also we have your pharmacological management. So how are you going to manage patients who have conduct disorder when it comes to your nursing side? So on the following slides, we're going to discuss nursing assessment and your nursing intervention. The first one is the following assessment of clients with conduct disorders include history taking po. So children with conduct disorder have a history of disturbed relationships with peers, aggression toward people and animals, destruction of property, deceitfulness, or theft, and serious violation of rules. Ano pa yung mga part ng assessment mo? General appearance and motor behavior. Appearance, speech, and motor behavior are typically normal for the age group but may be somewhat extreme. Mood and affect. Clients may be quiet and reluctant to talk or openly hostile and angry. Their attitude is likely to be disrespectful toward parents, nurse, or anyone in a position of authority. May mga problema ito sa rules and regulation. Judgment and insight. Now, judgment and insight are limited for developmental stage. Clients consistently break rules with no regard for the consequences. Last one sa iyong nursing assessment and role is roles and relationships. Now, when you talk about our relationships with other people, especially those in authority and disruptive and maybe violent. So once again, these are the nursing assessment for your conduct, behavior, conduct, personality disorder. Now, how are you going to? So, what are the nursing interventions for your conduct disorders? The first one is decreasing violence and increasing compliance with the treatment. So, kung nagte-therapy or naggagamutan ng iyong pasyente, increase compliance nga po sa gamutan at sa therapy sessions. So what are you going to do? The nurse must set limits on unacceptable behavior at the beginning of the treatment. For limit setting to be effective, the consequences must have meaning for the clients. That is, they must value or desire recreation time. Next one, you have your improving coping skills and self-esteem. How are you going to do this, nurses? The nurse must show acceptance of clients as a worthwhile person even if their behavior is unacceptable. This means that the nurse must be better of act about setting limits and must not make judgment statements about your clients. Promotional social interaction. The nurse identifies that it is not appropriate, such as profanity and name calling, and also what is appropriate to the client. Positive feedback is essential to let clients know they are meeting expectations. So last one, you have your providing client and family interaction. The nurse can teach parents age appropriately activities and expectations for clients, such as reasonable curfews, household responsibilities, and acceptable behavior at home. Tapos na nga tayo sa ating discussion for today. Thank you so much for watching. Please like, share, and subscribe to my channel for more nursing educational videos. Let me know if you have other nursing topics that you want us to do. Comment it down below. Abangan nyo nga po yung next upload natin next week at pakilagay po yung if there's any contents on my channel that you want to put or you want us to do next week, put it down in the comment section. Once again, I would just like to invite you guys to please subscribe kung hindi ka pa nagsasubscribe, and please follow my Facebook page. I'll be putting all the links to my social media accounts on the description box. Check that out. And yeah, once again, tulungan nyo na nga po ako. Ipamalitan nyo na ang pinakabago, pinaka-fresh at pinaka-libreng nursing review center sa balat ng YouTube. And I'll see you again next time.
Thank you so much, you guys, for watching. I hope you learned something, helping grow my channel. You are already here. You might as well subscribe. Hashtag Team Cool Talk. Give this video a big thumbs up and share with your friends. Let me know what you guys think. You put them down in the comment section below. Also, don't forget to check out other playlists I created for you. I'll be putting the links on the description box. Just simply click the second button right here. Let's connect. Follow me on all my other social media accounts. Everything is at Neil Galve except for my TikTok account, which is Neil Galve Official. Join ka na rin sa Facebook page ko. It's Neil Galve. I'll see you guys there.